Hello everyone, welcome to my YouTube channel Meditrix. So today we are going to talk about GCS score. Yes, the most important. This question is asked very frequently in the exams. Like they will give you a case scenario in which they will discuss the different components of GCS, and from the case we have to evaluate the score, the GCS score, and then evaluate the patient accordingly. So you should remember the GCS score. This is very important score and this is very important topic also in the trauma surgery, asked very frequently. The components are indicator of the outcome. So the GCS score has three components. Remember EVM, like EVM machine, right? EVM are the three components of GCS scoring. So eye opening, verbal response and motor response. These three EVM, and the score goes 4, 5, 6. E is 4, V 5 and M 6, right? So in E there are 4 scoring, in V there are 5 scoring, and in M there are 6 scoring. Remembering the E component actually is very easy. Eye opening is very easy. You don't even need the mnemonic for that. But then also I am giving it so to complete the table. Only we confuse in the V and M component scoring. So try mnemonic for that component specially. To calculate the score, we have to add all of them. It's like E plus V plus M, and then you get the final score. So first component is eye opening E. It has 4 scores. Eye opening has 4 scores. Remember that 4, 5, 6 EVM 4, 5, 6 EVM. So first component E has 4 scores. The 4 scores are, and we will start from 4, 3, 2, 1. So fourth is spontaneous eye opening, 3 is to loud voice, 2 is to pain, and last the 1 score is for no response. So 4, 3, 2, 1, spontaneous opening, eyes opening to voice, eyes opening to pain, and no response. So how to remember it? अपने आप आवाज दर्द नहीं देता. So अपने आप आवाज दर्द नहीं देता. Spontaneous to voice to pain, no response. So simply translate it in Hindi and remember, like 4 अपने आप आवाज दर्द नहीं देता. Now next is verbal response. So verbal response EVM 4, 5, 6. So verbal response has 5 scores. So let's remember the 5 scores. Fifth is oriented. The person is well oriented and has good verbal response. Comes 4 score. 4 score is the person is confused, disoriented. Then comes third score. Third score is for inappropriate words. The patient is speaking inappropriate words. Then comes score 2. It has incomprehensible sound. So the patient is making sound but incomprehensible. So, and the last one, score 1, where we get no response from the patient. So here goes 5 scores. Repeat again. Oriented, confused, inappropriate word, incomprehensible sound, and no response. Here's the trick. Try this. ओए confusing वो sound नहीं है. ओए for oriented, confusing for the confused, वो for inappropriate words, sound for incomprehensible sounds, and no response नहीं है. ओए confusing वो sound नहीं है. ओए confusing वो sound नहीं है. And now the last component, M component, that is motor component. So EVM 4, 5, 6. So M has 6 components. Here they are. So let's start from the 6th one. So sixth component, it is the patient obeys command. Then fifth component is the patient localizes pain. Then fourth component, and that is withdrawal to pain, that is normal flexion. Whenever the patient feels pain, he withdraws, or normal flexion action occurs. Score 3 is abnormal flexure posturing, and score 2 is extension posturing. The response to pain is extension. And score 1, that is no response at all. Again, 6 scores: patient obeys command, localizes pain, withdrawal to pain, that is normal flexion, abnormal flexion posturing, and extension posturing, and no response. You can remember this by a mnemonic OLX ab extra noob. OLX ab extra noob. So here goes: O for obeys command, L for localizes pain, X is withdrawal or flexion, normal flexion is X, then abnormal flexion, extra, that is extension posturing, and noob is no response. Remember, the best indicator of the outcome is M component, motor response, and the minimum score in GCS is 3 and maximum score is 15. Basis of the score, you can categorize the patient in 3 categories: mild, moderate, and severe. So mild goes 13 to 15, score is mild. Then moderate is 9 to 12, and less than 8 goes in the severe head injury. So mild head injury 13 to 15 score, moderate head injury 12 to 9 score, and less than 8 scoring is severe head injury. But what if the patient is intubated? Then how to calculate the score? If the patient is intubated, the V component of the GCS score cannot be calculated. The verbal response cannot be calculated. So for that, we will add the E and M components of the score, and at last we will write V and T. So we will add the E and M components of the score, and at last we will write V and T. For example, suppose E is 3, V cannot be calculated, and M is 6. So the total score goes like 9, V and T. Earlier 1 was added for this, but now it is not. So the score goes like 9, V and T. The same occurs in the case of tracheostomy also. Then there is another scoring, GCS P scoring. P is for pupil reactionary score. So if 1, then score 1, and if none, then score 0. We have to subtract the P component from total GCS score. So the maximum will be 15 minus 0, that is 15, and the minimum score will be 3 minus 2, that is 1. So the scoring of GCSP goes like 1 to 15. Then there is another score known as GCS PACT. Just know the full form of the PACT. PACT. P is for pupil, A is for age, and CT is for CT scan. So learn this by heart. Like नींद में से भी उठा के आपको पूछे तो आपको आना चाहिए. This is very important score. If you like the trick, press the like button, hit the bell icon, and share it with your friends. Thank you.